Good morning. How good and how pleasant it is for brethren to dwell together in unity. It's like precious ointment upon the head that ran down upon the beard, even Aaron's beard, down to the skirts of his garments. As the dew of Hermon, and as the dew that descended upon the mountains of Zion, for there the Lord commanded the blessing, life forevermore. Good morning again. I like to begin with that because it is good to be here. I'm originally from Detroit, so it's always good to come home. And it's always good to be here with you at CBTU. I'm thankful to President Lucy and to Chairwoman Patterson and to Sister Johnson. I don't see her here. She must have stepped out for a second. Gwen Johnson and others for bringing me back again this year, because it always feels like home and family when you work with unions. While I was here in Detroit, I had opportunity to work at a couple of the plants here, working on the line. They thought that, working on the line didn't make you appreciate going back to school. And it did. But I also appreciated it, though, because of the relationships and because of all the sharing of experiences that I had with people who were working there on the line, people who had a singular purpose, people who cared about their families, people who cared about their day-to-day lives and their jobs. So it is good to be here. And it's also good to be here because there's good news to report. As Sister Patterson, as I call her affectionately, mentioned last year, we introduced the Active and Saves Leadership Initiative, which is a part of the Active and Saves campaign that was launched in development with the White House and Department of Health and Human Services to refocus the nation's attention on the HIV epidemic here at home. And at the same time here with the Active and Saves Leadership Initiative, we talked about the idea then that we wanted to integrate HIV into the day-to-day operations, into the missions of these historically black organizations. And I'm glad to say that CBTU has done that. Sometimes people will take money and run with it, but it's always good then to see it when people actually put it to use and are actually putting feet on their faith. As a result of CBTU's efforts and as well as those of the other 16 now organizations that have joined us with the Active and Saves Leadership Initiative, that millions of people have been exposed to HIV/AIDS messages, thousands of people have been tested, and thousands of people have been trained on how to deliver those messages wherever people live, work, play, worship, and learn. But there's still more work to be done. As I shared with you last year, and I'll remind you again this year, that every 9.5 minutes, someone in the U.S. becomes infected with HIV. Again, that could be your daughter, that could be your son, it could be you, it could be your mother, it could be your father, but someone is infected with HIV. And so because of that, and because of the new estimates that we have, we see now that in their lifetimes, that 1 in 16 black men can be expected to be diagnosed with HIV, 1 in 30 women will be diagnosed with HIV, and today that AIDS is the third leading cause of death for black women, 25 to 34. So there's definitely more work to be done, but there's hope. The hope is that we have hope because HIV is 100% preventable. But we know that it's also going to take a little bit of faith. And for some of you know that what faith is, right? That faith is the substance of things hoped for, the evidence of things not seen. But we also know that faith without works is what? Faith without works is dead. As I flew in last night, I also was on that another midnight flight from Atlanta coming in. And as we flew into the city, you could see all the lights from Detroit. Detroit looked beautiful. And you would not know, looking at it from 10,000 feet up, that Detroit was experiencing the kind of problems that it's experiencing. You wouldn't have known that Detroit was suffering from some education problems. You wouldn't have known that Detroit was suffering from economic problems. You wouldn't have known that these problems existed. But we know that when the light comes on, that when the sun begins to shine, that things that once looked beautiful aren't necessarily all that they seem to be. And that's essentially what happened last year. Last year, the lights were flipped on. The lights were flipped on by President Lucy. The lights were flipped on by Sister Patterson and Sister Johnson when you said that there was a problem, that HIV was ravaging black communities, black homes, and black families all across the country. And so with that knowledge and the expectation then now that you were going to join with us and for this leadership initiative came a greater degree of accountability. Because we know that when you know better, you're supposed to do what? You're supposed to do better. And so because of that, then you're all held accountable. Some of you may not be able to see, but here above the podium, they have there's a screen here in front of us so that the people that sit here on the dais can see the speaker without straining their necks. So essentially, then, I'm sitting here looking at myself right now. And so, as I say for all of you, that there are thousands and millions of people, those who are living today and those who have gone before, who are looking at you, because we're going to be held accountable for what it is that we did while we were here. So, in a sense, this is yet another opportunity to get involved. We know that from this first year that at least 25% of the CBTU has supported Sister Patterson and Ms. Johnson in some of your events, but that still leaves another 75% that hasn't necessarily got involved. So why haven't you got involved? Are you tired? Are you tired? No. Are you tired yet, or are you tired already? Those are two questions that I always think about when coming to these types of forums. When you look around and see all the faces, some of you pleading with me as I sat there and give me the eyeball like, please, brother, don't take long. Please. So are you tired yet, or are you tired already? So are you tired yet? Are you tired of continuing to hear these bad statistics? Being from Detroit, I got tired of always hearing about all the bad things about Detroit. Murder capital of the world. You know, we have the depression, we have everything is. The belief is that Detroit is going to be better. Detroit isn't all that it seems, just as Councilwoman Jones mentioned earlier. And so we as a people also aren't all that we seem. I get tired of hearing about black folks being number one for this and number one for that. Every time it's something negative. Every time you hear it on the news, what's the first thing you think about? If anyone says that blacks were number one for HIV, no one would have been surprised by that. You would have taken a reasonable guess that maybe that could be the case. But we know that that doesn't have to be the case. And so for those of you then who are tired, we ask who are tired, are you tired yet? We're asking for you to get involved, because with HIV, it's 100% preventable. 100% preventable, meaning that this is something that you actually can do together, that we together can win. That's not something then that, you know, regardless if you run or bike every day and eat all the right foods, you still have some chance of developing hypertension or a cancer or some other things based upon your family history. But with HIV, we know that it's 100% preventable. So for those of you then who are tired yet, then I ask for you then again to join us. But then there's also another crowd. And I would say that then there's some of you may be here in this audience that, you know, are you tired already? So we began this journey 1 year ago. There have been meetings, there have been programs, there have been events, and there's been some success. But there's still more work to be done. So I ask for you then to help us all take it up a little bit higher. I ask for you not to be weary in well-doing. For in due season, we know that we shall reap if what? If we faint not. And that's exactly what we're going to need to do to take this up a little bit higher. So as I go to my seat, I promised you I was going to be brief. I ask for you to believe again. Just like these signs on here on the table, I saw that they have a believe again. And the thing is that, you know, people sometimes don't want to move forward because they've lost belief, just as Kimberly had mentioned earlier. They didn't necessarily understand what the risks are, as Ms. Robinson had mentioned earlier, because leadership comes with a cost. I'm currently reading a book called Leadership on the Line, and it talks about that cost, the fact that more people don't take leadership, more people don't take action because they are afraid of what it's going to cost, what it could cost them personally, what it could cost them professionally, and HIV certainly comes with some of that. What are people going to say to you if you come to them with some HIV information? Are you infected? Are they going to question sexual orientation? Are they going to question whether or not you have some other type of ulterior motive? And why should I make them aware of this information? Why should I talk with them? People are going to do what they want to do anyway. Well, the case is that people do what they want to do. But how is it then that we want healthy lives? How do we make that something that people want? How is it that we make people know that that's something that they deserve? So we ask for you then to believe again. Do you believe? Yes. Then again, I ask for you to join with us so that we can take this all up a little bit higher. Because just as your theme said, yesterday's vision, and I would add today's action, will help us to realize tomorrow's realities. Thank you very much.